the pharmacy was completely looted. They wiped him out. So it becomes a problem. Even the neighboring center at Bridge City, it's a mall, they'd actually looted everything there, and they even burnt down some certain parts of the mall. So in the neighboring areas, currently, there's no GP practice.
To run the X-ray practice is so expensive. Just the general X-ray, our equipment, that was the cheapest digital that we have. It cost us plus minus 700,000, only the X-ray machine. Now counting the desk, the chairs, the basic computers for the secretary and the what, we are counting at plus minus 800,000.
We're actually seeing in the looters come in here injured after them going and looting. And it's so unfortunate that you'd feel that these same people that I've worked hard for, I've committed myself to, they coming and bearing this grant on us. After doing this, now they expect us to also help them.
How will we restore medical security and supply after the looting? Are health facilities in your community likely to open again? Will we meet the vaccination target since most sites are closed? Hello and welcome. I'm your host, Zama Buthelezi. So what's today on Vital Signs? We focus on health facilities and pharmacies that were vandalized and looted during the riots. We then speak to the Acting Chief Director at the National Department of Health and the CEO of the regulator, the South African Pharmacy Council. Afterwards, we give you an update on the latest South African COVID-19 numbers. And lastly, Dr. Marlene McKay will answer your questions about COVID-19 symptoms. So what's coming up on the program? But remember, you can still share your thoughts with us on social media, on Twitter using at SABC Vital Signs or on our Facebook page, SABC Vital Signs. Vital Signs continue right after the break, where we'll be speaking to the Acting Chief Director at the National Department of Health about the health facilities that were vandalized and looted, and we find out what is the way forward. Please stay with us. Dr. Mbali Mabaso, the owner of a small medical center in KwaZulu-Natal in Enanda, arrived at her doctor's rooms only to discover that it had been burned and looted during the unrest in the past 3 weeks. Dr. Mabaso lost medication and equipment to the value of more than 500,000 rands. At the moment, she is not sure if she still wants to rebuild her doctor's rooms in the same community. Take a listen.
Dr. Mabaso, could you kindly tell us which community are you from and what health services do you offer at that community?
So it's Besta and Phoenix. So it mainly serves the community of people from Inanda, Wamashu, and I also see some people from the Phoenix area as well.
Now, in the past few weeks, we've seen unrest leading to damages of health infrastructures. Could you just kindly tell us when did you learn of the damage at your facilities and what was damaged?
Later on in the afternoon, I got to find out that they actually entered into my practice, the general practice in Phoenix, and this had a roller door and it was locked, and there was a sliding door as well. So somehow they were able to open the padlock, and then they pushed up the roller door and they barged in through the sliding door. So they went into the practice, they looted everything in my actual doctor's room. There was my desk. Desk was still there because it was a fitted desk with floating shelves. They took everything from there. There were files in there. There were my masks, my ornaments. I had nice ornaments. Even my certificates. I think they wanted the frames. They took the frames because on the floor we just found papers. And at the back, I had a pharmacy. I'm a dispensing doctor, so I used to keep medication as well. So they took my syringes, injections, There's also examining in the examining area room. There are drip stands. They took that as well. An ultrasound machine where you normally examine a patient with, BP machines, glucose machines to check your blood sugar, blood glucose, an ENT diagnostic set as well. They took that. They just wiped me out.
Access to health facilities, even before the unrest, has always been a problem for many communities. Now, after this damage, how do you think the community will be affected by the looting? As we've explained, that medicine have been stolen, some of your syringes have been stolen. How is this going to affect the community?
So in the neighboring areas, currently, there's no GP practice. And now these patients, you find them having to go to the government sector. So government hospitals are overpopulated now. Government clinics are also like this. They're overwhelmed because there's just too many patients. And you find out that in my practice, I'm also like a chronic a medical practitioner. So most of my patients were on chronic medication. So it becomes a problem even to my patients as a whole, because their medication had already been dispensed and it was at my rooms and they were going to simply come and collect it. So now it means everything is destroyed. We'll need to restart again. We'll need to re-see these patients and get them into the system again and then prescribe medication again for them, which medical aid, some of them said, no, we'd already dispensed that medication. You have to pay for that cash because we'd already dispensed that medication.
How has this affected you and what's your way forward? Are you willing still to rebuild in the same community or will you be moving your practice elsewhere?
So for now, I'm still distraught. I'm still trying to weigh my options and see, do I go back to government where I know that it's a stable environment, or do I try and just rebuild again? But obviously rebuilding, it doesn't happen overnight. You have to buy medical equipment. That's expensive. So I'm just, at this point in time, I'm still confused at what to do.
Dr. Babazo, that's the time that I have for you. Thank you so much for participating on our show.
Okay, thank you so much.
A sad story indeed there. Hospitals and clinics in South Africa's hardest hit provinces are picking up the pieces following the riots that saw the vandalizing and looting of health facilities in the past 3 weeks, which has left many of them running out of medical supplies and having to deal with staff member shortages. On top of this, COVID-19 vaccination sites were also hit hard by the unrest. Here to give us a sense of the situation and a way forward, we are joined by Dr. Leslie Bamford, the Acting Chief Director at the National Department of Health. Dr. Bamford, good morning and welcome to Vital Signs.
Good morning to you and to the viewers, and thank you.
Doctor, this is quite sad. You know, this community depends on the services provided by this doctor, and you have people on chronic medicines who depend on her facility, and now they have to travel distances to access health care. And by now, I'm sure the situation they find themselves in is quite dire, as they are not supposed to stay without their medicine. But tell us, we heard of private practices and some public facilities looted. How bad is the situation in these two provinces?
So I think I must start by saying that obviously we as the National Department of Health are very shocked and distressed about the disruption and destruction that occurred, particularly in KwaZulu-Natal, but to some extent in other provinces. We know that our health services currently are under pressure because not only are our health services currently needing to provide routine essential health services to our communities, but they're also having to deal with the impact of the COVID pandemic and with the implementing the vaccine rollout. So I think these disruptions and destruction came at a very bad time. Having said that, I think it has been heartening to see that there has been a relatively rapid recovery. So my particular focus is on the vaccine rollout. And whilst it is true that during the week of the unrest, all our vaccination sites in KwaZulu-Natal were forced to close, almost no vaccinations were done in KwaZulu-Natal during the week of the unrest. As soon as the situation calmed down, our vaccination sites were able to reopen. And although the province is not back at absolutely full capacity, they are doing many vaccinations, and all the public vaccination sites have been able to reopen.
That's great news, Dr. Bamford, especially because we as a country, we had started just to see the numbers of people coming through to vaccinate picking up. We saw people on social media really excited to go out there and vaccinate. But how long before we see all the facilities up and running?
So unfortunately, in KwaZulu-Natal, there has been a fair amount of damage, predominantly to private pharmacies. And we're still waiting for the full reports to see how many and how quickly those private pharmacies can respond and reopen and begin vaccinating again. As I said, our public sites are up and running. You correctly point out that we are now at the point where vaccination has been opened up to more people. This has been possible because we are starting to receive more vaccine supplies. And so we know that we have already started to ramp up. And in the coming weeks, we will continue to ramp up significantly. The president has set us the target of reaching 300,000 vaccinations per day. And we are confident that in the next few weeks, we will be achieving that target and vaccinating that number of people each day.
Doctor, we're still on vaccination. I know that because of the unrest, some of the people who were scheduled for the second jab couldn't access these facilities. What happens to those? Are walk-ins allowed? Can they still come through? It will not be a problem?
So absolutely. As I'm sure you know, we do have a scheduling system. If people were scheduled for an appointment and missed the appointment, they will be rescheduled. However, people are also able to walk into our facilities, and particularly if people missed a second dose because of the unrest or for any other reason, then, as I said, they can wait to be rescheduled, but they are also welcome to walk into any of the vaccination sites.
Doctor, I remember reading somewhere where they were saying the cash in transit heist didn't want to go out there and deliver money because of the unrest. And apparently, the South African Medical Research Council was planning to reach the 60 and over people for vaccination where they withdraw their monies. So that couldn't happen because of the unrest. So any plans to reach those people? I know that some of these people don't have access to cell phones to register. Any other plans to reach them just before we go to break?
So one of the programs that we tested at the beginning of July and are planning to now scale up in subsequent months is to access people who are waiting to cash in their SASSA grants. So that program took place in the first week of July and was in fact not affected by the unrest. So that program was successful during the first week of July, and many people, particularly our special target group of people older than 60 years who were collecting their pension payouts, were vaccinated. As I say, in July, it was a relatively small program. We were testing it to see if it would work. we found it to be successful, and we are planning to scale it up next week, the first week of August, and in subsequent months.
Doctor, please, we'll come back to you. Stay tuned for this. Let's take a short break. We'll come back. We continue our discussion with Dr. Leslie Bamford, the Acting Chief Director at the National Department of Health. You can also share your thoughts with us on social media via Twitter using at SABC Vital Signs or our Facebook page, SABC Vital Signs. Please stay tuned. Community members and medical practitioners are left reeling after days of violence and looting, leaving health facilities destroyed. What was not taken was broken. And one of the centers that was not spared was the Umthwalume Center in KwaZulu-Natal, where X-ray equipment was looted and destroyed. Let's take a listen at this package.
Could you just kindly give us a picture of how much damage was done and what were some of the important stuff that you guys work with that was looted?
They broke in and took all the computers, the one for X-rays, the one that and the printers, the image readers, and then they tried to open the X-ray machine, but we don't know how deep is the damage on the X-ray machine, as only the technicians can tell us. But the way the cables are, it doesn't give us hope that we can still use the machine.
With the damage caused, Nosipho, how do you think it will affect the community?
Umthwalume is the rural area. We are in the deep rural, and that is the only service that they have, the X-ray, and the only GP that they have. Now, with this looting and damage and everything, the people now have to drive down to either Port Shepstone or Hibiscus to get the X-ray and the doctors there. It's going to be bad. It's going to be bad because there's no service for them.
What is the plan or way forward from now on? Are you going to rebuild and stay in the same community, or are you also one of those who are now reluctant to build in the same community?
We need to rebuild, because really, if we leave Umthwalume, where are they going to get the service? They don't have anyone except us.
What sort of assistance would you like to see coming from the community or maybe the officials watching right now? What form of assistance would you like from the community?
Firstly, we started on the Facebook page, Umthwalume Facebook page, asking the community, whoever knows anyone who got the X-ray equipment, to bring them back, because they won't use them. Number one, if they can help us to get, if they can, we ask them to take it to our Inkosi and leave them at Inkosi Lutuli's house, or drop them at the securities at the center. Or they can try and do whatever just to bring, if they can. Again, what I expect from them is to protect the medical center, because that's the only one that they have.
No, thank you so much, Sis Nosipho, and best of luck to you and yourself.
Thank you, Andile. Thank you very much.
We continue our discussion with Dr. Leslie Bamford, the Acting Chief Director at the National Department of Health. Dr. Bamford, just listening to that story and knowing the area and hearing our interviewee saying this is the only center available for people there, and now they have to travel and spend a lot of money to access healthcare. As the department, will you be able to assist such communities in terms of rebuilding?
So I think we will, first of all, there needs to be a full assessment. Our understanding is that the majority of damage in KwaZulu-Natal was to private sector facilities, with very limited damage to the public sector facilities. As announced by the President on Sunday, schemes are going to be put in place to assist businesses, which would include the private health sector, to rebuild. But I think we nevertheless, as I indicated previously, are very shocked and distressed by this, because we know that it will take a time for these facilities to be rebuilt and to be able to start providing services to our communities again.
Dr. Bamford, the riots happened at the worst time in the country, when we're facing the Delta variant, which was spreading like wildfire. And we heard about our hospitals having large numbers of admissions. So now during the riots, we had people that were injured, people that were killed. Surely this must have put a strain on the public health system. Tell me, doctor, are you coping as the public health because of what happened recently?
So as indicated earlier, our health services are under strain currently because we are having to provide routine health services. We are having to deal with the COVID pandemic, and then of course the vaccine rollout. Luckily, it does seem that we have passed the peak of the third wave. So our hospitals did have some capacity to cope with additional patients resulting from the riots. But of course, we would prefer to be focusing on other elements, particularly the vaccine rollout, but also ensuring that we provide good quality routine health services to our communities.
Doctor, the Prince Cyril Zulu Communicable Disease Center, one of the biggest dispensaries of chronic health medication in KwaZulu-Natal, was not spared, and as a result, they had to close. Do you have any idea if they've opened and they've started dispensing these chronic medicines?
So one of the real problems within the public health sector as a result of the unrest was that many of the chronic medication, there's pickup points where people are able to access their medicines at a convenient location. Many of those pickup points were damaged or destroyed in KwaZulu-Natal and to a lesser extent in Gauteng and Mpumalanga. So a lot of work is going into restoring that system, because of course it is critical that people have ongoing access to their medication at a place as close and convenient, as close to where they live or work, to ensure that it's convenient for them. So the system is kicking back into gear. I don't have the exact details, but over the next month or so, we do anticipate that services will be restored.
Doctor, lastly, the people who looted medicines, especially your chronic medicines, apparently they are selling it now in the townships. What is the danger of using these medicines without being prescribed by the doctor, or even seeing a doctor before to give you the correct dose? And also, I doubt if they are even aware that even storage of these medicines is important. What would you say to these people is the impact of what they're doing?
So certainly it can be very dangerous to be using medicines and vaccines under less than optimal conditions. We are concerned. Approximately 40,000 doses of vaccines disappeared from one of the private sector storage facilities. unless these vaccines are kept under the correct storage conditions, they will not be effective, and they may be unsafe. So we would really urge anyone who has information about stolen vaccines or stolen medication in general to report that either to a nearby health facility or a police station. Vaccines and ARVs are available free of charge at all our public sector health facilities. And so really there is no need for there to be a black market in these medications and vaccines. And as I say, we would really discourage people to be using them without supervision, and to report any people who are distributing these medicines or vaccines to the relevant authorities.
Dr. Bamford, I wish we still had more time, because I wanted also to talk about those who are using ARVs, putting them on wunga and smoking it, the impact of that. But hopefully next time when you join us, we'll talk about it. Thank you so much for the interview.
Thank you very much.
That was Dr. Leslie Bamford, the Acting Chief Director at the National Department of Health. After the break, we speak to the CEO of the regulator of the South African National Pharmacy Council, Vincent Tlala. You can also share your thoughts with us on social media via Twitter using @SABC Vital Signs, or on our Facebook page, SABC Vital Signs. Vital Signs continues. Please stay with us. The recent unrest in KwaZulu-Natal and Gauteng saw healthcare facilities vandalized, medicines looted, blood service premises vandalized, and oxygen deliveries delayed. Such life-threatening and potentially deadly actions have been condemned by those in the medical fraternity. The protests have also put an additional strain on the health system and healthcare workers already stretched to the limit by the surge in COVID-19 cases. To discuss the aftermath of the unrest and looting of pharmacies, we are joined by Vincent Tlala, the CEO of the regulator, the South African Pharmacy Council. Mr. Tlala, thank you so much for talking to us. Briefly, tell us how many pharmacies were looted and destroyed in these two provinces?
Thank you very much, and thank you to the viewers. If I could talk to the number of pharmacies that were affected by this unrest, there are about 140 pharmacies that were affected. In total, in KZN, we're looking at 88 pharmacies, while in Gauteng, there are 49 pharmacies. In Mpumalanga, there were 3 pharmacies. If I further break down those numbers, 51 of those pharmacies are what we refer to as large chain pharmacies, your Discams, your Clicks, your Medirite, or what we refer to as group pharmacies. And 89 of those were independent pharmacies.
Mr. Tlala, I'm thinking about the independent ones. Were they even insured? Is it going to be possible to go back and for them to go back and give these services to the people that depend on them entirely?
Look, it would differ from one pharmacy to another. We are comfortable that there are those who were insured, but those entry-level pharmacists that just started might not have had insurances. So they would mainly rely on the government scheme to try and get them going so that they can be able to go back to the very same communities and provide services.
So, Mr. Tlala, are some of your members even still willing to go back to serve these communities after what just happened?
We can comfortably say, and in particular with the large group pharmacies, that the majority of them had said they are going back in those areas to rebuild. They've heeded the instruction from the president to say we are in a rebuilding phase. So the majority will go. And yes, there are independent pharmacies. I mean, just yesterday I picked up on Facebook, one of the pharmacies that were affected in Mamelodi has indicated that they have reopened. So there will be those that will be able to reopen. Some might take some time, given that they do not have the insurance. So while willing to go there, because one needs to go back, initially these people saw a need in those communities. And for that very reason, the need is still there. It's just that they were disturbed by this unrest. So the majority will be willing to go back in those places.
But surely, Mr. Tlaga, this is not going to happen overnight. I'm sure it's going to be a while. And as much as it impacts on the owner of the pharmacy or the big chain, it also impacts on the livelihoods. You have people who depend on these pharmacies in terms of employment. What would you say to that?
We agree the impact goes far beyond just merely the shortage of medicines. It goes to the economic impact in terms of the livelihood. If I could maybe just give you an understanding of what goes on, a small entry pharmacy would employ a minimum of 7 people. That would be your pharmacist, 2 pharmacist assistants, a clerk, a cashier, a cleaner, a driver. So that's what constitutes a small pharmacy. Whereas when you look at the medium-sized pharmacies, you're looking at between 30 to 50 people. The large big group like your discount pharmacies on average employs roughly around 80 people. So the impact would be felt in those communities, because suddenly these people are without employment. We do appreciate that most of these people are saying they will start the rebuilding process. It might take some time. Some might be 6 months, some might be a year, but we're comfortable that ultimately the services will be restored.
Mr. Tlala, Cipla, which is a major manufacturer of generic medicines, had the factory in Durban looted. What would be the impact, especially on those who are on chronic medicines?
Maybe just to talk to the issue of Cipla, we understand Cipla supply mostly antiretroviral drugs, generics, but the department has said that we are in the process to source out alternative supply. From our records, we have enough manufacturers in this country. As I speak to you, we have around 254 registered manufacturing pharmacies in the country. So we understand that the Department of Health will work with these manufacturers as the alternative source of supply. While one is saddened by that, but I guess the department will find alternative ways to make sure that the supply line is maintained.
Mr. Tlala, another issue is that some of these medicines have to be stored at a certain temperature, and by now they are out there in the townships and people are buying them. What would you say to those who are using these medicines which are not properly stored, and they are not talking to medical practitioners in terms of doctors and pharmacists to tell them on the doses that they're supposed to be taking? What would you say to such people?
Our message is clear. Not only ourselves, other statutory health regulatory bodies have expressed the same. Our advice, even the Department of Health has expressed the same. Do not buy any medicine that is from the black market or from the street, for simple reasons that those medicines, one can't guarantee the integrity. Remember, medicines are not ordinary commodity of trade. They are required to be stored under certain temperatures. For that very reason, when they are stolen and they are placed under conditions that are not good, they become harmful to yourself. So, simple message, do not buy such message. If you do come across such medicines, please refer those people to the authorities, the South African Police Service or the South African Health Product Regulatory Authority, SAPRA, so that they can assist in dealing with such matters. But our advice is return those medicines to pharmacies so that they can be properly disposed of or distracted. Because medicines cannot just be hoided in drains. They need to be distracted properly.
Mr. Tlala, lastly, some of these pharmacists, I know with big pharmacies, they have systems where they will put patients' details on computers and they're able to retrieve them. But some of these, like your small businesses that have just started, are you seeing that they are having challenges because even their computers were stolen? So what's going to happen to these records?
Maybe let me start. We expect that most pharmacies are supposed to have backup records of the medicines that they would have dispensed to patients. So yes, the big chains have what their records stored on cloud. We are anticipating that there will be those pharmacies and the small ones that might have no records stored on cloud. So our advice to patients is go back to your pharmacy, find out if they do have your records, and then they can be able to reissue those medicines or direct you to another pharmacy where they can issue medicines. Where those records are not kept, we advise patients to go back to their prescriber, their doctor, so that they can reissue the prescription. So that would be our advice. But of importance, we are saying medical records should not be tampered with. If there's any message that we would want to send out to the South Africans at large, as much as it is your right to protest, there are certain places that we, according to us, are sacred, like your healthcare establishment, whether it be a doctor, a surgery, a nurse practice, or a pharmacy. Our message to the people, no matter how unhappy you are with government or any other person, those places should not be touched, because the very same protesters, if tomorrow they require services, you need these pharmacies to be able to access your medical help.
Mr. Tlala, CEO of the regulator for the South African Pharmacy Council, thank you so much for the interview.
No, thank you very much. And maybe lastly, let me thank all the pharmacists that are participating in the vaccination rollout program. And we say to all of the pharmacists that are not yet participating, please participate so that we can roll out as many vaccines and get them in the jabs of many South Africans.
I couldn't agree with you more. Thank you, Mr. Tlala. That was Vincent Tlala, the CEO of the regulator for the South African Pharmacy Council. After the break, we give you an update on the latest South African COVID-19 numbers, and then we speak to Dr. Marlon McKay. He will answer your questions about COVID-19 symptoms raised by some of our viewers on social media. Please stay with us. The third wave of COVID-19 that has gripped the country for weeks is showing signs of receding. While the 7-day moving average has declined since the 6th of July, the National Institute for Communicable Diseases, that's the NICD, has warned that it might be too early to celebrate indications that the third wave has reached its peak. Trends in the coming week will be important in confirming whether the peak of the third wave has indeed been reached or not. For now, though, let's take a look at the national COVID-19 statistics. Over 4.7 million tests have been processed in South Africa. Over 2.4 million positive cases have been recorded. Over 2.1 million people have recovered. But sadly, more than 71,000 people have died from COVID-related illnesses, and we're sending our sincere condolences to their families. more than 7 million people have been vaccinated in the country. So what's happening in the provinces? The 7-day moving average daily number of new cases has decreased. Gauteng still remains the epicenter of the third wave of this pandemic. The number of Gauteng vaccination sites has been increased. And for those who are not able to go and vaccinate during the week, you can do it over the weekend. Eligible South Africans are being urged to register and get their jabs. For now, though, let's take a look at the infection numbers recorded. In the last 24 hours, over 3,900 positive cases have been recorded in the Western Cape. Over 3,600 positive cases have been recorded in Gauteng. Over 1,900 positive cases have been recorded in KwaZulu-Natal. Over 900 positive cases have been recorded in the Eastern Cape. The remaining provinces are also seeing a decline in numbers of new infections. While this is good news, it doesn't mean that people should become complacent, as COVID is still around. We have seen what has happened in the past where numbers just increased significantly. And mind you, the Delta variant, which is more transmissible, is still around. For now, though, let's take a look at the numbers recorded. Over 900 positive cases have been recorded in Mpumalanga. Close to 700 positive cases have been recorded in the Northwest. Over 600 positive cases have been recorded in Limpopo. Over 500 positive cases have been recorded in the Free State. Over 400 positive cases have been recorded in the Northern Cape. So those are the statistics, but do remember that as we observe and report on COVID-19 cases, the numbers can change, sometimes significantly. Vaccine registration is still open for those ages 35 and over. By now, we all know a friend, relative, colleague, neighbor who has been infected with the virus, as well as those who have died. So let's continue to take precautionary measures, and these include regularly washing our hands with soap and water as the virus stays active on surfaces that we touch. Sanitize using sanitizers containing 70% alcohol content. We must all continue to wear a cloth mask that covers both our nose and mouth in public, even if you're vaccinated. We must continue to practice social distancing and ensure proper ventilation indoors. Most importantly, avoid mass gatherings, as these are super spreaders of the virus. So if you believe there's a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. The number is 0800 029 999 and alert them to your symptoms. Remember to protect yourself, to protect others. Frustrated South Africans who have been infected with COVID-19 and are in isolation at homes continue to take their frustrations with symptoms to social media in order to get medical help. But this has come back with even more frustrations, as people who are giving advice are not medically trained to do so. General practitioner Dr. Marlene McKay joins us to give advice on COVID-19 patients on how to treat their symptoms at home. Good morning, Dr. McKay, and welcome to Vital Signs.
Good morning, Zama. Thank you for having me again.
Doctor, before we go to our Facebook comments, I just want to find out from you, how long can one wait to be vaccinated after testing positive and quarantining for 10 days?
Yeah, so there's two basic scenarios, Zama. We have those who have had COVID as a mild illness. They have not been admitted to hospital. They manage their symptoms quite well at home. So we count 30 days from the date of de-isolation. So once they've completed their 10 days, they count 30 days forward, and on that day they can book to have their vaccine done. Or you can also say 30 plus 10, 40 days from the first day of symptoms. But the best way to remember, 30 days after you have recovered. For those who have had more severe illness, where they've been admitted to hospital, required oxygen and spend more time in hospital, we advise that they wait 90 days before having the vaccine. The good news, of course, is that they are, with the natural immunity of having had had COVID, there's no sense of urgency to get vaccinated because you have natural antibodies. So for general purposes, mild illness, 30 days, more severe illness requiring oxygen and hospitalization, 90 days.
Dr. McKay, someone was asking me whether what are the best exercises, or whether people should even exercise when they are still facing short breaths after recovery.
Yeah, so we advise very strongly, Zama, that we do not, patients should not participate in any sort of exercise while they remain symptomatic after COVID, particularly related to the chest pain, lungs, shortness of breath, or excessive fatigue. No form of exertion for at least 6 to 8 weeks after recovery, or depending on how long the symptoms persist. And the reason for this is that one may damage your heart muscle to the point that you may never be able to exert yourself. So please give your body time to recover, rest it out. Don't rush back to gym until your doctor has given you the go-ahead. And if you're starting to feel better, I will advise just gentle walking, a gentle stroll for a few minutes a day, and then gradually increasing it by a few minutes every day. But under no circumstances, if there's any fever, any chest pain, any shortness of breath, don't even do housework, would be my advice.
Doctor, if one is diabetic and coughing, should they take cough mixtures?
Yeah, so I'm a very, very strong believer that one should not even be using cough mixtures for coughing, and particularly in the COVID scenario. With regard to diabetes, remember, many of the cough syrups also contain sugar, so that it may increase the sugar levels in a diabetic, which then increases the risk of more severe disease. So we try and refrain from cough mixtures and rather treat the problem. Treating the problem is it a COVID pneumonia, or is it just a post-nasal drip? Is it just inflammation? So you rather treat the problem than rushing off for a cough mixture to try and just treat a symptom. You may mask underlying conditions or worsening of the COVID itself.
Doctor, if one experiences body pains after vaccination and also heart palpitations, what can they take?
Yeah, so it's fairly normal to experience some mild side effects post-vaccination, especially the arm. You may experience body pains. So what we call simple analgesia, paracetamol. You may want an anti-inflammatory if the muscles feel a bit sore, but it's not necessary to take anything really stronger than that. Don't exercise. Rest your body until you feel better. Take the medication for 2 or 3 days, and usually there's a great response after that. And don't be scared of any body aches and pains and avoid the vaccine. Please make sure that you still get vaccinated, irrespective of all the stories one hears.
Jenny Gomes, doctor, is asking, do any of you get a sniffle from the cold winter air? I'm paranoid about it. No other symptoms, but nose is runny. Antihistamine helps, but one never knows with this pandemic. Easy for people to say, get tested, but who has the money for that? I think COVID is affecting our mental health too. If only this thing was the same symptoms for everyone, it will make it easier and straightforward. Should Jenny go and test, doctor, with just the sniffle?
Yeah, that's such a great point. And my gut feel says probably not. If it's just a sniffle and nothing else, it's pointless because COVID is an illness with a syndrome, with a collection of symptoms. And those symptoms usually get more and get worse as time progresses. So as you go through your 10 days, there's usually more symptoms added and worsening. If you're just waking up with a sniffle, it's probably just sinus with no other symptoms. It gets better with an antihistamine. It's probably not necessary. However, if you develop more symptoms or worsening, then it's absolutely imperative to go and test. The other thing, Zama, the last thing is, if you strongly suspect COVID and you can't afford a test, please just isolate. Isolate for the 10 days, limit the spread of illness, and then it doesn't matter because you haven't passed it on to anybody.
Dr. Chanel Sonepul is asking, she says, not me, but a family member of mine, day 14, blood on mucus when coughing, been feeling better, just a little weak, not having trouble breathing. Any advice on what medicines to take?
Yeah, so again, my first question would be, are they on any blood thinners? Because usually with the bleeding, they've been taking high doses of blood thinners, and we may just have to cut back, reduce the dose, or maybe even stop that. That could be one cause. If there's excessive coughing, it may be a pneumonia developing or bronchitis, excuse me, a secondary bacterial infection. They may require an antibiotic. Day 14, they are no longer infectious, so it will be safe to at least have a healthcare practitioner have a listen to the chest and see where that is coming from. Also check if the mucus is not from the sinus or post-nasal drip, which can also be blood stained. But generally, Zama, it's not too serious, especially if they're breathing okay, no shortness of breath, and the oxygen saturation levels are still appropriate.
Hlengiwe Hlophe is asking, please help me, ladies and gentlemen. My feet, calf muscles, and my hands are so painful. I've tried paracetamol, 1 gram, but it's not helping. Any suggestions, please?
So I would just suggest maybe just add a mild anti-inflammatory to work together with the paracetamol, such as ibuprofen or naproxen or diclofenac. One of the simple, really cheap, fairly safe anti-inflammatories. You add it onto the paracetamol and it can give significant relief of those muscle aches and pain.
Jon Brits is asking, how accurate is the rapid test?
Yeah, so that's such a very good question. And the problem with the rapid test, it's all about timing. If the time is right, in other words, if you get tested early enough, when your symptoms have just started, it is fairly accurate. If you come around about day 5, day 6, it's going to show negative, which is usually indicating falsely negative because you may still have COVID. And so what I tell my patients is, if you have been exposed to somebody who tested positive for COVID, and subsequent to that you develop COVID-related symptoms, you are regarded as positive even if your rapid test shows negative. And I think that's very important for those who have been having rapid tests. Just because it's negative does not mean you are negative. You need to look at it.
Well, that was Dr. McKay. We just got cut off there. Are you still there, Dr. McKay? Well, Dr. McKay is no longer with us. Would like to thank all our guests for participation and to our viewers for watching Vital Signs. Don't forget, the only way to manage this pandemic is if we all play safe and protect each other. Remember to stay at home, social distance, wash your hands, and wear a mask. I'm Zama Butelezi from Vital Signs. Do take care.